my name is Kara Fairbanks, and I'm a board-certified registered psychiatric nurse in the inpatient psychiatric setting at Billings Clinic. And today I'm here with some of my distinguished colleagues, my team, to talk about a new innovative approach that we've taken to treating mental illness. This is known as triple chronotherapy. And so today, basically what we're going to do is tell you what triple chronotherapy is and what it entails, the important research that we've been doing and have done, and our expectations for the future and our hopeful outcomes. So it is without further ado that I go ahead and hand you over to some of these amazing team members so that they can share their expertise and insight into this really, really cool process that we're doing. So thank you and enjoy.
Well, what is triple chronotherapy? Basically, triple chronotherapy is a manipulation of sleep-wake cycles. It's a 5-day protocol. The first day, you go almost 36 hours without sleep, and then we advance the sleep cycle forward each night after that. And every morning there's a 30-minute period of bright light therapy. We do this to treat depression. Well, what's exciting about triple chronotherapy is basically it started with a patient, and a very difficult patient, a patient who was severely depressed, extreme self-harm behaviors, covered in cuts, and refused medication. And our physician was willing to take the risk, and our staff and our leadership, to try something really innovative that had worked with adults. And so basically we had an amazing success story on our hands, and we wanted to do more. I don't think that at that point we realized that we were going to be doing original research in this area, but what we found out was that it really hadn't been used in adolescence, and that there was room to do some original research in this area and maybe make a huge difference in patient care. We don't know exactly why triple chronotherapy works. We do know that it resets circadian rhythms, and this has some effect on depression, and there's been really amazing remissions of depression using this protocol.
My name is Andrea McDonald, and I am a BSN, board-certified nurse in psychiatry. And I am here to talk about what the nurses have to do when we receive a triple chronotherapy patient. So they are admitted to our unit, and if we know that they're starting triple chronotherapy that day, we immediately talk to the charge nurse and find out if we can get a one-to-one staff for the first night. They will be awake for 36 hours during that time. So the one-to-one staff helps prepare them for what's to come and gives them an idea of how long they're going to have to be awake. Sometimes they get really sleepy, so it's good for the nurse to be, the one-to-one staff to be there to help keep them awake, keep them active, engage them in conversation, do that kind of thing. After the first night, the nursing staff will be responsible to make sure that the Hamilton Depression Scale is done by somebody who has been trained to do it. And then they will also help facilitate their care in any way possible, such as treating any sudden onset of depression, suicidal thoughts, anxiety, that kind of thing. We will also be responsible for medicating the patient as the doctor has prescribed their medications for the day.
My name's Kyle LaRosse. I'm a mental health worker over the Billings Clinic Psychiatric Center. I've been working with the triple chronotherapy team for about a year now, maybe a year and a half, 2 years. Like my coworkers said before, when that one-to-one staffing comes up for that particular patient, every patient's different, every single one. From the moment they walk in the door, they have it's a new story. It's like a brand new reason for them being there. And to be that one-to-one for that youth patient who's probably experiencing something horrible, and especially at such a young age, and trying to encourage them to not only power through and to join groups and to be positive and to try and have a positive outlook on this whole thing. You're trying to encourage them to break the habit of not only getting rest, but sleep in general. And a lot of times what happens with patients like these is they have a breakdown. They don't always know what is going on, what is happening, if they're even doing the right thing, if this is the right kind of treatment that they want, and to continue that even past their hospitalization in our unit. And to show them that, this is a positive thing, it's a positive change, and to be able to not only be there for them as a one-to-one, but also as a staff member who's providing excellent care for them and trying to make sure they have everything they need over those next course of 5 days. The first time I did participate actively in the triple chronotherapy. We had this patient, he was a 17-year-old youth. He'd been in treatment practically all his life, about 8 years. His family didn't want him, he just felt unwanted and unloved. When he came in, he was covered in cuts. His whole arms were just covered. And I had never seen anything like that. So for me, I was like, holy crap, like really this guy is not kidding around. And one time on our secure unit, he actually was able to find something to cut with. It was a little like plastic syrup corner thing from one of our cafeteria trays. And it was something so small you would never really think about it, but he did. And that first day that happened, and seeing him, actually so motivated, so amplified to try something new, anything new, just to have even a chance at a future was just wonderful. And going from that first day I met him to the last day, just seeing the change, like his physical appearance, how bright he became, the happiness that just radiated from his eyes. And he wasn't even faking it. He wasn't even trying to fake it. It was literally genuine. That was what gave me the motivation to actually continue doing this, to continue helping my team, as even if it's so small and so minimal, to be able to be there for that patient who might be going through this horrible, tremendous thing, and then seeing the afterwork of it, to seeing our hard work and everyone's hard work actually succeed. This is our light box. This light box is what we use for triple chronotherapy. After they stay up all night, and at 7 o'clock in the morning, as soon as it turns 7, we turn this light on. And this light is meant to it's like a battery charger almost. You're looking at it and you're like, I can see the light. It's so beautiful and wonderful, and it makes me feel so good. We like to think that anyways. But this is one of the many tools we use to actually treat our patients who are on triple chronotherapy. It is a 10,000 lux light. You can buy them anywhere, especially at Bed Bath & Beyond. This is our Hamilton Depression Scale. It is based off 17 questions. Any of the number of the triple chronotherapy team can actually admit this assessment, especially the doctors. We like the doctors to do it. This is how we assess how the patient's doing overall. When they first become admitted, we assess them based off this scale. And with this scale, this gives us almost like a baseline. So this is how this person feels genuinely throughout their experience with this depression. And then every day throughout the course of the treatment, we like to administer this test at 11 o'clock a.m. just to kind of keep that consistency. And also to see if there's any change or any improvement over the course of that treatment based off their score. What I'd like to say is, especially for even if it's mental health workers, even though we might feel sometimes our job is minimal, we make a huge impact on these kids. And to really change those people's lives, even if it's just for 3 days or 5 days, no matter how many days, it's our job to basically try and help them save themselves. And that's what makes me keep coming back. And I hope it does you too.
The Center for Clinical Translational Research at Billings Clinic has been working extensively with the psychiatric team to get triple chronotherapy up and running. We designed this study incorporating methods that have not been pursued in this area before. So additional measures have been taken to assure no sacrifice in content or interreliability. Essentially, this is laying the framework for limitations to be minimized and generalizability within our population to be both expanded and more clearly understood in further research.
I'm Mariela, I'm one of the child psychiatrists, and I'm going to be talking about the triple chronotherapy protocol. And I know you've probably heard about the importance of being consistent with the research from Nick and about what research implies. So I'm just going to refer to the protocol. This is a study that we're doing in the unit to assess the if it's efficacious and safe to use triple chronotherapy as an adjunct treatment for depression. So we do this in the inpatient setting with kids who have been admitted for safety concerns. So either they have suicidal ideation or attempted suicide, and they found to have depression, either unipolar or bipolar, and we want to see if other than the usual treatment we do, we can add triple chronotherapy. So the only inclusion criteria are the age. So if they're here and they're more 13 years old or older, they can be included. Moderate or severe depression that we measure using the HAM-D. And then you have, they have to be in the hospital. So they were hospitalized for reasons others than doing this treatment. And of course, the patient needs to be motivated to do the treatment because it's not easy to stay up all night. So once we identify the patients, we obtain a consent from the parents and an assent from the patient. The severity of depression we rate based on a HAM-D that only some of us went through some training for this, so we are asking that only Kara, Diane, Eric or Zubi, myself administer this testing, and also Andy and Kyle also went through the training. So this testing, it's not a patient field test. It's something you ask by asking certain questions about depression, and then you score it yourself. So this is not something we give to the patient. Other than that, we get some other scales. So of course, another of the criteria is the patient has some suicidal ideation or the safety concerns. So we administered a Columbia Suicide Rating Scale, and this is something that we assess. So we ask some questions and fill them there. Then we also assess their sleep with an insomnia severity scale. That's the patient feels this. There's a scared short version scale, which is a scale for anxiety. It has 5 questions on it, and the patient also will self-administer that. And then you have urges to self-harm, Likert scale, so from 0 to 10, and the patient feels this as well. And once we get all these, as a baseline, we also get an ACE questionnaire, so the Adverse Childhood Experience questionnaire, just to see if there's any correlation once we get the results of the study with trauma in terms of the response. So this is done before the patient starts the study. So what we do in this triple chronotherapy study, and most of you are familiar with it, but I know there's sometimes there's staff turnover and some of you might not be. So there's 3 components in triple chronotherapy. The first one is sleep deprivation. So the first night the patient spends in the unit, they don't get any sleep at all. And that we have a one-on-one with the patient overnight so that they can monitor the patient is not falling asleep, entertaining them, playing cards with them, taking them to the gym, or whatever is needed for them to stay up. And then that's the first component. The second component is the light therapy that we do every morning from 7 to 7:30. So we have a light therapy box in the unit and lamp in the unit, and we use it with these patients. So the third component is the sleep phase advancement, and this is very important that we follow. So what we do is the second night the patient will go to bed at 6 p.m. and will wake up at 1 a.m. Then the day after, this moves from 8 p.m. to 3 a.m. and then 10 p.m. to 5 a.m. And so we're just advancing the sleep cycle. And those are the 3 components. Every day we apply some scales. So there's 3 again that the patient feels, and there's 2 that the provider will get. So the first one is the HAM-D, which is again only administered by the people I told you about. In the second day, we just ignore the sleep questions because, of course, the patient didn't sleep at all last night, so we're not going to ask them about their sleep. So we don't apply the sleep questions in the HAM-D, so we just score 0 there, and then we don't give them the insomnia severity index scale. The other three, the SCARE, the Columbia, and the self-harm scale, are going to be the same. So the Columbia is filled by the provider by asking questions, and then the SCARE and or just the self-harm scale are filled by the patient. And in day 3, we do the same scales plus the insomnia severity scale, and same at day 4 and day 5. And there's an additional scale that, again, only the ones who went through the training would do, and that's the CGI, or clinical global impression. So that's kind of a one that we do at baseline and during the last day, so that we can monitor what the change is. But this is usually done by the investigators or co-investigators. So that's what the triple chronotherapy is about. I know it takes a little bit of, going outside of the usual care, and might have some implications for the staff in terms of more duties. But even if it wasn't a study, we would like it to be done the same way. So it's a very structured protocol for this treatment to work, and if we don't do it this way, unfortunately, we cannot call it triple chronotherapy. But we really appreciate all the efforts that you're making with us on this, because I think research is the way we're going to make things better for these kids in the future, and make our institution more known around the country, and all of you are part of this. So thank you very much, and I hope this is clear. If not, you can always reach to Eric or myself or Diane or Cara or Andy, or any of us is happy to talk to you about the protocol or any questions you might have. Thank you.